Good afternoon, everybody. Welcome to the weekly broadcast here at St. Clair County. My name is Justin Westmiller. I'm the Director for Homeland Security and Emergency Management here at St. Clair County. And with us today is our special guest,
Deb Johnson I'm the Executive Director for St. Clair County Community Mental Health.
Thanks for being with us, Deb.
Thanks for having me.
All right, we're going to go right into our weekly status update. Today, we've got 672 total cases, 134 hospitalized, 53 deaths, and 565 recovered. In the last 7 days, our changes are 44 new cases, 6.3 average new cases per day, 271 average tests per day, and 5.0% positive tests per day. So that number is starting to creep much higher, and we really need to get a handle on that.
Weren't we actually at a point where there was only one new case a week?
We were just a couple of weeks ago, and then
as soon as it feels like the increase. I know part of it's additional testing, but a lot of it is also the opening of way more businesses and
the activity
and people feeling they don't really need to social distance.
It is.
But that seems to be having a direct impact on the numbers.
If we can, the masking and the social distancing can really help tamper that down. So
I agree. Okay.
And I like those new masks.
Thank you. St. Clair County Community Mental Health logoed masks, a gift for each of our employees, and hope that they'll use them.
Yeah. So on the next slide is our 7-day average of new cases, and as you can see, way back in March we had that huge peak, and we started coming down, and now we're kind of on a steady rise, which is surely not the way to go. So we're looking to make a turn and start headed back down. So we can use all the help we can get in that. The next slide, average number of daily tests per week against the percent of positive COVID tests. So the blue bar is showing that we're doing about 250 plus, between 250 and 270 tests per day against the red line that shows the percent positive, and that's floating right around 5.0%. So you can see what's happening there. And then the next slide just shows the health department's daily board where they update all the numbers every day. So, and what's the website you can find that at? I know Doc always updates it, but what?
scchealth.co.
It's scchealth.co. So that's where you can find that dashboard. So the next thing I wanted to talk with everybody about real quick before we get into the question and answer session is there's been some community comments that we're just loading questions in, or we're kind of placing favorable questions into some of our questions. And I want to assure the community that we're not doing that. What we're doing is, if we don't receive questions onto the Facebook site as we're doing this live, we have kind of received questions throughout the week from our call center or from our Facebook postings throughout the week from our Joint Information Center. And we are saving those and being able to answer them here live for our community. So we're not just creating favorable answers and questions for you all just to make it feel like we're doing something good. We're really trying to get the right information out for you all. So I wanted to get that out there and talk a little bit about that today. So, and again, I'm very happy that Deb's here today. The community mental health side is so important, especially in a pandemic, because there's so much that's happening in our community, and so much of it is mental health. This is probably the hardest thing all of us will ever deal with in our lifetime, and on a global scale. And I'm really happy she's here to help answer some of the difficult questions today. So
if you want me to talk a little bit about,
please do.
Okay,
Yes.
Some of this stuff that we know since this COVID has started. The Kaiser Family Foundation has done a study where almost 50% of all adults reported saying that their mental health has been negatively impacted from COVID-19. So even with the reopening of things in our area, there's still a lot of anxiety, because there's still people that have anxiety about going out, especially because, we've seen when you go into certain stores and things like that, people aren't wearing the mask that they're supposed to. Now the order changed, and now there's more severe penalties for not complying and for the business themselves, which I'm glad about, because that is forcing better compliance. Although, before we started today, we still talked about somebody, a patron at a restaurant, that started punching out the people because he didn't want to wear his mask. And it's like, fine, you have a choice not to wear a mask, but then you don't get to go in the restaurant. So anyways, I think that that's super important. And but I think that there's a lot of stress and anxiety about that. In our own building at Community Mental Health, you must wear a mask. You must get your temperature taken. You're asked a series of questions. We've had a couple of people who have lunged at our nurses because they didn't want to wear the mask. And obviously understand that some of the folks coming into our building are coming because they know that they need to work on their mental health issues, and they could be very symptomatic. So, but still, we can't jeopardize the health of everybody in our building because somebody doesn't want to wear a mask. So we do have other options for people that can't wear the mask. We can do telehealth and different things like that. So I just wanted to say that. And, I guess if you're not sure about if you think that you're feeling like isolated or increased anxiety, or you're feeling depressed, you're not sleeping as well, all those kinds of things certainly could be related from this whole COVID situation. And we know that it is, because even in our staff, we have mental health staff that understand all that, and they are reporting symptoms of, being kind of feeling traumatized by some of this stuff. And some of the work, they're essential workers, so they've had to work throughout the pandemic, throughout the stay-at-home order, especially our assertive community treatment team provides services in the community, our mobile crisis unit, our nurses. And so we have to recognize the importance of self-care. You got to take care of yourself. And the best thing you can do for that is, there are things that you can control in this situation. We can't control the number of COVID cases, and we can't control the people that won't wear their masks, but we can control where we go. And when if we can't maintain our 6 feet, we got to have our mask on, and that includes outside. I think we saw probably a spike across the country with all the protests related to the racial injustice in our country. People needed to have masks on. It's okay. Obviously, I support the cause 100%, but it's just important that you wear your mask when you're in that kind of a situation. So, but people do have anxiety about all those kinds of situations. You get stressed out. Should I plan that trip in January or shouldn't I? I'm thinking about that too. It's not causing me a ton of stress, but I do want to. I always go away in January, and I missed multiple, going away like to Florida or whatever last year. So yeah, there's a lot of things. Some people have economic stress, because even though everyone's like, oh, how could that happen? How is that? Because they're laid off and they get that extra $600 and whatever else. But there's a lot of people not getting their unemployment because there's a ton of unemployment fraud in our state and in our country. Some of it they think is actually happening in the UIA from their workers, and some is through identity theft and things like that. So there are people, if you don't have other people helping you out during this, I'm not sure what they're doing, because I personally know of some situations that have not received a penny yet. So those people are struggling. So they got the COVID thing, they got the financial stress. Maybe they, at least, although did they extend, you couldn't evict anybody, and then that order that lifted, but I don't know if they put it in place again or not.
I'd have to check.
Yeah, I'm not sure about that either, but anyways, there's just still a lot of stuff out there. So I guess one of the things I just like to remind people that we have a lot of resources available. Our Facebook is loaded with resources on self-care. And also, if you feel like you need to come talk to us or talk to a professional, you can call our access line. It's 888-225-4447. It'll probably appear somewhere on that Facebook page. We can see just about anybody right now. Doesn't matter if you have private insurance and in the past you may have been turned away, but we are what's called the CCBHC, which is a Certified Community Behavioral Health Clinic. And as we can see anybody that has mental health issues, they can have private insurance, they can have no insurance. So we've expanded our access to services. So if people feel they need to talk, we can do telehealth. Like if you're anxious about coming into the building, that's okay. We can do it over the phone. Unfortunately, if you need medication, you probably got to come in at least once, because we got to do vitals and things like that. And then our doctor will see them via telehealth. But yeah, so we have we have services available. Even if you just want to talk on the line, we have that COVID support line. You can call the number and just say, I just need to talk to somebody. I don't need a full intake with you guys. Just want to talk to somebody. You can do that too. So And if people can't get what they think they need, you can always call our agency and ask for me, and I'll follow up on it, and I will try to help them out.
That's great.
Yeah.
So we have a couple of questions coming through on the Facebook Live, one for Justin and one for you, Deb. How does somebody report a business that is not complying with the Facebook mask order?
So the best way to report a business is to the MyOSHA hotline, and I gotta pull up the number because I had it handy last week. Before the end of the, give me one second, and I'll have it for you.
We'll go to Deb's question.
Yeah, go to
and
Deb's
come back
question
to
and
you.
I'll have it for you.
Somebody's wondering if courts are open for petitioning for mental health services or guardianship.
That has never stopped through the whole pandemic. So if you feel like somebody needs to be petitioned, you can contact probate court, or you can contact us because we have people that can assist in that process. So if you're not sure what to do, call us, and your question, when you don't have to go through the access, you can just call the 985-8900 and say, I need to talk to somebody about petitioning, the petitioning process. And we'll have somebody get back with them and give them that information.
You have that?
10 seconds.
Okay. We had another question from yesterday that I'll pose to Justin. We can also put the MyOSHA
I got it.
hotline in the comments as well.
Yep.
We had a comment yesterday asking about, can you use a face shield in place of a face mask?
So that's a commonly asked question, and the answer is no. Now, a face shield is better protection than nothing at all, but a face shield does not replace a mask. It just doesn't afford the same protection for others that a mask does. It doesn't catch everything that's coming out that a mask does. So the answer to that just directly is no. Now, to follow up on the previous question, that telephone number for the MyOSHA COVID response hotline is 888-535-6136, and we will put that in the comments section. And I believe a graphic may be being developed right now by Russ, the producer.
If there's any more questions, I have a couple more things I would like to say, if I can.
Absolutely.
All right. So we also have right now, we've been doing a lot of like free classes, like through, it's like Zoom. Some have been Zoom, but some are through it. We have this thing called the Life Size Unit, same thing. But anyways, so we currently have a trauma-sensitive yoga class, and it's every Wednesday morning at 9 a.m., every Thursday at 5:30 p.m., and for information, you can go to get it from our Facebook, our website. You can call our main number. We'll tell you how to access that. It's completely free. No pre-registrations required. You just, you want to do it Wednesday, but not Thursday, and maybe next week Thursday, but not Wednesday. That's fine. Nobody knows. You can turn the video off for you if you want, and then you just watch and do what you want to do. So that can be can help really be very relaxing, and it's a great mindfulness activity. So the other thing, we entered into a partnership with MSU Extension. So they're going to be doing a variety of classes related to stress less and relaxing alternatives to anger, things like that. And they're going to start in the very near future. When we have that start date, we'll get that information out on our website. And then I just want you all to know still that we talked a little bit about, I said some of our employees are a little bit anxious still about, because we have almost 400 employees, and out of that number, only about 40 of them worked throughout the stay-at-home order, worked on site. The other ones were working from their houses, doing telehealth and things like that. Well, when they had to come back into the building, a lot of them had a lot of anxiety, even though the building was great. Some of us who had to work all the way through, we loved how relaxing it was in there, and it's super clean. But anyways, so we have the CIS, which is Critical Incident Stress Management Pandemic Response Team. We can send a team out to talk to your employees, and even if they're already back, but you're still sensing they're kind of anxious, they're not real thrilled to be there. So we can come, it can be, any number of people, a small number to a larger number. If we need to break it into a few groups, we can do that. So there's that. You just contact us. We also have a mobile crisis unit. If you are in crisis, you can call that number, 966-2575. Or you can call 888-225-4447. Both of those numbers, 24/7. And you can get help. I already talked about the the COVID counseling, mental health support counseling line. But there's a text for that too. I think, can we scroll those numbers or put them up there somehow?
Post them.
Okay.
Yeah, we'll post them.
Okay, so we'll have those numbers posted. And then there's this Headspace app. It's a free app. It's pretty cool. It's available at michigan.gov, and it helps you with mindfulness and meditation, relaxation, things like that. So it's really good. So those are the other few things I wanted to add.
Yeah. So we have another question for you, Deb. If someone wants to receive in-person services at CMH, how does that work?
Well, actually, we have this great video that was put together by a person that received services from us because she suggested to us that, hey, things are going to be different and people need to understand how things have changed here since COVID-19. So her name is Cindy, and it's on our Facebook, it's on our YouTube site. I don't know where else it is, our website. But here I can just tell you briefly. What happens is you come to the main building, you make your appointment, you get your appointment, you come to the main building or whatever building. When you arrive, if there's more than one person, you're going to have to stand 6 feet apart while you're waiting. You get your temperature taken. A series of questions are asked related to exposure to COVID or COVID positive people. And then you have to have a mask. If you don't have one, we supply one, but you have to have a mask to enter our buildings, like I said earlier. And then, so then when they get in with their therapist or doctor, whoever it is, they'll be for sure 6 feet apart from them, but they still have to wear their masks. That's kind of how, I forgot the hand washing station. That happens too, right? After you get through the vestibule area, then there's like the hand sanitizing, all that kind of stuff. So you do that as you move through. So that's how it's different, I guess. We're trying to do some groups again. We are doing some actually. So instead of being in the cozy group rooms that we've had, they're in our large auditorium, and we put like the Sam's Club six-foot tables and one person per table, so we know that they're all spaced out. And we've done some of that too. So that's how it is a little bit different than it was in the past.
That sounds very safe, though.
Yeah,
So.
I think so too. And we used to give out more food during, groups and things like that. We're not really doing that.
Yeah.
So our galley's undergoing major renovations. That used to be actually like a cafeteria. It's going to be open sometime in the future for takeout. And it's been a training program. So we've been doing online virtual cooking classes, things like that, which has gone pretty good. So anyways.
All right, we have another question for Justin. How many COVID tests are done per day in the county?
So right now we're averaging between 250 and 270 right now, right? That's a fair number. So that's where we're at right now, which is really pretty positive.
Is that per day?
Yes.
Wow, that is a lot.
So if I've got a couple of questions here, I will answer because a couple of them are really important. One of them is really important that I want to get to, and it's kind of popping up. I want to clear up for everybody. So today, well, not just today, but I want to talk a little bit about quarantine and what it means if you've been placed into quarantine. And even though you may test negative while you're in quarantine, but it's like the third day of your 14-day quarantine, that does not release you from quarantine, regardless to the fact that your test was negative. You could even test on the 10th day of your 14-day quarantine, and you still must finish your 14 days of quarantine. That's just the requirements and the rules in the law regarding quarantine. So we just wanted to make sure that everybody understood that, and that just ensures that you are clear and able to re-enter and not potentially be asymptomatic and carrying, because you could potentially shed just a little bit and not pop positive on the test that you took, but then 2 days later potentially be sick, and then you would have released yourself from quarantine, been out in the world, and then potentially, be asymptomatic and be shedding enough RNA to make others sick. So that's why you have to finish that 14 days of quarantine. Hopefully that helps clear things up for people. So anything else, or do you want me to? All right, so I have one other one that's pretty important here. What should I do if my family member should pass away from COVID-19 overseas. So when a U.S. citizen dies outside of the United States, the deceased person's next of kin or legal representation should notify the U.S. consular or the embassy officials or the State Department. And that's super important. And you can do that by calling 1-888-407-4747 toll free or 202-501-4444. But you should do that as quickly as possible. So you can either call the State Department or get a hold of the embassy or any consular officials wherever you are in whatever country you're in, if that should happen overseas. We got a couple of questions on that, and we wanted to make sure that that was very clear, because for some reason you or a family member could be traveling overseas, and that was a pretty important question we wanted to make sure we got answered. So, and then another pretty important one, because I manage it personally, is how can healthcare facilities manage PPE supplies during the COVID-19 pandemic? So when this first started, we had a very difficult time with PPE because there was none available anywhere. So my office had to work with the state, with Emergency Management and Homeland Security Division at Michigan State Police, basically to get all of the PPE that was available, just to make sure that all of our first responders and our hospitals and any of the doctors' offices that were open could continue to operate, because there was none available to order. We went through a major national shortfall and almost a global shortfall because of everybody needing it all at once, and nobody was making it anymore. And we're still it's very tight still to this day. So basically, in March, there was a decision made at the CDC on what masks were okay to use during this pandemic, and how you could use them, and how you could actually reuse them when before it was illegal to reuse them. So there's been some rule changes just while we get through this pandemic on how you use and reuse N95s, and how you can use surgical masks in lieu of N95s when it used to be required. So there's been a lot of rule changes just because of the access to PPE. So I just wanted to clear that up a little bit, but my office has been centrally managing PPE for kind of many months now, since March, on how we've been passing it out and been procuring it for all of our first responders and our hospitals and our doctors' offices. So I wanted to get that out.
And Deb, can you speak to children who are staying in their rooms, who are feeling depressed during this time because they're having to stay home from school? Can you speak to some resources that are out there, or things that parents can do?
Yeah, there again, on our Facebook page, we posted a ton of resources about things to do with your kids. And for sure, you should not let them stay in their rooms all day long. You need to, get them outside. Especially, we were really lucky that even kind of the beginning of the shutdown, the weather started to break in Michigan, so you could get outside even if it was a little colder, but sunshiny days. But kids need to get outside just as much as adults do. Everybody does, and then try to provide the same kind of structure as they had during school time. So don't let them start sleeping till 11 or 12 in the afternoon when they were getting up at 8. I actually just talked to a parent yesterday who said that she lets her child, he's 13, he can stay up till whatever time he wants, but he's got to get up at 8 o'clock every single day. So he has self-regulated, and he goes to bed at a reasonable time because he's got to get up at 8 o'clock. He's got chores to do. He does some online class stuff. Even though it's summertime, he's working on some stuff. And then he gets to play his games, and then he has outdoor stuff. So I think that that's really important. And if you still think that your child is having really a lot of difficulty with all of this, you need to call our access line, and we can talk to your pediatrician about it first if you're more comfortable with that. But then contact us, because our staff have made tons of activity kits for kids and families, giving families advice on things to do with their children. So there's a lot of there's a lot out there, a lot of resources, and we still don't know what's going to happen in the fall with school. I mean, I've heard a couple of different things of possibilities. but I've heard different things from people in different school districts, even within our county. So I'm not exactly sure what the status is. I don't have any school-age kids anymore, so I'm not quite sure. But anyways, yeah, so there's a lot of things out there, but definitely kids can be impacted. I almost think it's the older kids, maybe middle school and high schoolers, that have had more of an issue with this. And some of them are the ones that have glommed together again once a lot of the stay-at-home was lifted, and they're not being very cautious about it. And I just think that that's so important. I can't believe some of the stuff that I've heard kids are doing, like maybe older teenagers, like COVID parties. They chip in money, and whoever gets COVID first wins the pot.
I haven't heard that. That's a new one.
Oh yeah, I've heard that from a few different people, and I asked my 20-year-old, "Have you heard about that?" She's like, "No, but that would be the dumbest thing ever." I go, "Yeah, I think so too." Because, I mean, like we all know, one person might be asymptomatic with COVID, another person's going to be seriously ill. Yeah. So why would you do that? But anyways, there's, I just think, but the kids who miss so much, like the seniors in the high school that missed all those important milestones, or whatever you want to call them, in your time at school, that's kind of traumatizing. That's very sad. Athletes that missed their last season to play sports, all those things are, I think, pretty traumatic. So if you get over the trauma within 30 days, it's not PTSD. But if it lasts beyond that, then it is, and you need to get professional help. So like I said, some people can get through that stuff, work through it. Other people cannot. Doesn't mean you're any less or more than the other person. Just need some support to do it. So I would just really encourage people to call our access line. We have a great children's services department.
So for people who are concerned about COVID rates and infection as the state continues to reopen, what are some ways that they can responsibly enjoy the summer months and things that they can do outside?
Well, I think there's, especially in St. Clair County, we have a ton of great things to do. One of my favorite things is golf. It's an outdoor activity. You could walk, and then you for sure stay away from the person right next to you, because I don't really want to wear a mask while I'm golfing. I think it would throw my game off. But as long as you stay away from each other. And then obviously we have our parks, our trails, bike riding, walking, all those kinds of things. So there's a lot of great things to do in the county. But remember, the key is, if even outside, if you're going to be closer than 6 feet apart from people, you got to wear your mask. Right. Be safe about it. I don't know what else to say. Hopefully, people have seen some of our great billboards that say, if you won't wear it for yourself, because I've heard people say, "Oh, I don't need the mask, I'm good." And I'm like, I don't think you understand. The mask is to protect us from you, not you from me. And so I have to wear my mask to protect you. So I don't think people understand that, because they're like, "I'm good." I'm like, yeah, what about the person who's going through chemo treatments right now? And mostly this whole community knows I had breast cancer, and I had chemo 3 years ago. And during that time, I wanted to go somewhere, and my doctor said, "Yeah, it's not a good idea. Your immune system's so low." And I said, "I'll wear a mask." And she said, "It doesn't matter if you wear a mask. Everybody around you has to wear one, because a mask only, it doesn't even fully protect you, the wearer of the mask, from the germs that can get shot into your eyes, your ears, your nose. Well, maybe your nose is okay. But anyways, you know what I mean. So anyways, there's a ton of fun things to do in the community. You just got to do it responsibly.
Yeah. So this will be the last question. And we saw this over the hotline a lot this week. Can you tell us how long it's taking to get test results back?
Yeah, so right now we're seeing anywhere from 2 to 5 days is the length of time to return a PCR test. And that's actually a little better than we've seen in the past couple weeks, where we were seeing 3 to 7 days. So we are doing a little better in processing tests, and that's actually because we've had some better access to some different labs. So if you need a test, go and get a test done. If you need to find where tests are given, you can go on the MDHHS coronavirus website. There's a really great test finder website on there, and get a test if you need one, or if you want one. Either way. So.
And isn't it pretty easy in our community to get it through? Lake Huron has a drive-through. I don't know if McLaren does a drive-through, but you guys are doing it here too at the St. Clair County Health Department.
On Tuesdays. You just have to pre-register.
Yeah, pre-register. Yeah. So, and I don't think you need doctors.
You don't.
Okay. So there's a great resource that if that can go on the Facebook for people, I think that would be very helpful.
And we've been broadcasting that pretty heavily. So yeah.
We have just one more question really quick. I just joined. If you were exposed to someone who has been exposed to COVID, how long should you wait to be tested?
So if you're exposed to someone who's exposed to COVID, that's called an exposure to an exposure, and you don't need to be tested. You just need to kind of pay attention to yourself. And if you should start having symptoms, then you go and get tested. But an exposure to an exposure is really nothing more than you just kind of need to be alert to what's going on around you, and pay attention to yourself for a while, for like the next 7 to 10 days, and make sure you don't have any symptoms. If you don't have any symptoms, you are fine to kind of go along and move on. An exposure to an exposure is not necessarily anything to be overly concerned about. You just have to be alert to it. All right?
All right, so closing comments.
Deb, go first.
Well, I don't really have, I gave all the information I wanted to. I appreciate this opportunity to talk about the mental health resources that we have. I sincerely hope that anybody who thinks they might be having some issues, and maybe there's still a lot of stigma with mental health issues. So let's just call it, you're feeling a little bit down, you're feeling isolated, you feel disconnected, you have a little more, you're anxious. Call us, and we can point you in the right direction. If you don't want to actually come in for services and you're not, you just need some support, we can do that too. So I just encourage people to call us. And again, thanks for the opportunity to talk to the community.
Well, Deb, it was a real pleasure having you.
Thanks.
And for everybody out there, we've been saying this for a long time now. This is an awfully difficult situation for everybody, for all involved. And I think that the community at large is doing a really great job taking care of each other. And I know I appreciate all the work that everybody's doing. So keep it up, and we'll see you next week. Thank you, and have a great weekend.